Well, good afternoon, everyone, and welcome to the weekly seminar series at the Dahdaleh Institute for Global Health Research. My name is Professor Mary Viktorovich, and I'm the acting director for the Dahdaleh Institute. Today, we're delighted to host Reginald Quansah, who will lead today's seminar entitled Invasive Aquatic Weeds Biomass Briquette Production for Cooking, Implications on Health and Livelihood. I'd like to begin, though, with a land acknowledgement, as is our usual practice. And as this is a hybrid event and guests are on different territories, please take time to give thanks and respect to the land on which you're currently living and working. So today we're here on the York University campus in Toronto that's situated on the traditional territorial area known as Toronto, and we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. We acknowledge this as the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. This territory is subject to the traditional One Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. So let's begin with a brief introduction to our speaker, Reginald Quansah, who is an environmental epidemiologist and senior lecturer at the University of Ghana. His research generally focuses on children and women's environmental health, assessing exposures such as pesticides, air pollution, and climate change on the health of populations like mothers, children, low-income communities, and occupational workers. Reginald has previously collaborated with the WHO, contributing to the development of a training manual on air pollution and health for clinicians. He also served as a member of the WHO External Review Group for the update of the Global Air Quality Guidelines. So in today's seminar, Reginald will discuss the environmental effects of invasive aquatic weeds, which are known to disrupt ecosystem health, accelerate climate change, and increase the spread of disease in Ghanaian riparian communities. He'll then explain how these invasive aquatic weeds can also be turned into high-quality biomass fuel briquettes, which can be used as a low-cost, efficient fuel source, provide safe, nutritious meals, and generate employment opportunities for low- and middle-income countries. So this is a one-hour event that'll end at 2 p.m. We'll start with a presentation from Reginald, followed by a Q&A period, and then wrap up and conclude at around 2 p.m. So, Reginald, over to you.
Thank you very much. And I'm also very grateful to be hosted in this institute. This is my first time of coming to North America. I play around Europe. I think it's the first time coming to. Now, I appreciate the invitation you've extended to me. The topic has changed slightly, but the content is the same. Double burden of environmental menace, invasive aquatic weeds, and household air pollution in riparian communities. I work with a number of people. I have Ph.D. students that I work with, and as you said, my background is in environmental epidemiology, and I think currently I have a drive to move into applied global health, where we look at solutions to address indoor air pollution, and this is one of them. Those are the structure of my presentation. The main objective is to reduce the burden of NCDs in riparian communities by promoting the use of invasive aquatic weeds, biomass briquettes. NCD is globally a very big, especially in developing countries. Now, in Ghana, NCDs constitute about 60% of all this country. It's rising, and we know that the attributable factors are on diet, physical inactivity, tobacco use, and harmful alcohol use. But recently, WHO has engaged household air pollution as the fifth most important risk factor for NCD. But however, household air pollution has not been included in national policy programs in most developing countries. Household air pollution has been relegated to the background. You know, in Ghana, generally about 75% of the household rely on biomass fuel for their total energy needs. We know that in Ghana, about 16,000 premature deaths are attributable to household air pollution. And recent WHO data suggests that about 3.2% of Ghana's national revenue NCDs are due to household air pollution, from about 4,000 deaths from acute respiratory infection, 34,000 from chronic COPD and cardiovascular disease, and almost about 3,000 from ischemic heart diseases in women. So household air pollution is a big thing, but not much attention has been given to it in most policy documents in Ghana. Consumption of household air pollution, we know, has led to about decline in forest cover in Ghana. You know, there's a decline of about 2% of our forest areas every year, and most of those is attributable to wood being cut for fuel for household consumption. The challenge we have in Ghana is that there was a decline in the availability of biomass fuel. In the face of those, there's a global increase in the price of LPG that most countries are pushing for. And so there's one aspect of it, LPG prices are going up. They're not available. But our traditional fuel that we've been relying on is also declining, because these days people have to go deep into the forest for able to get access to fuel. And then there's a need to look for alternative energy source, especially for poor households. Most programs in developing countries, especially Ghana, Kenya, concentrating on promoting LPG. For example, in Ghana, we have the LPG recirculation model. The low-income communities are not targeted, so we need to get other alternative sources for them to survive. So there's a need to search for energy sources that are renewable, cheaper, available, and accessible to the poor community. And given the price of LPG and its inavailability, there's a need to look for other resources that are readily available and also sustainable. I'll give a little background of aquatic weeds. Aquatic weed was introduced into West Africa around the 1980s. And then it spread, and we know it's very invasive. Water hyacinth, we know, is the most productive plant on earth. And experience and research shows that if you cut down water hyacinth within 12 months, it comes up again. So it's very difficult to manage, especially all the invasive aquatic, especially water hyacinth. In Ghana, water hyacinth was introduced in around 1984. And since then, that's when our problem began. Almost all the rivers in Ghana are infested with water hyacinth. Almost all the rivers in Ghana are infested. I think the only river that is spared is the white volta and the black volta. The rest are all infested. If you come to lower volta, there we have several challenges with the. I want to go back. I'm going forward. Wait, okay. And so the issue of looking for alternative fuel is very relevant. Why am I talking about briquettes? In the energy ladder, you can conveniently place briquettes a little bit above the transition energy sources. Because this is a very typical energy ladder that we all know about. And now we know that the left one is not automatic. In most households, they do stack. So people don't completely abandon their fuel. So they keep to other traditional fuel. So I'll comfortably put briquettes over charcoal, coal, paraffin, candles, wood, and so forth and so forth. Of course, fuel wood is part of the primitive energy sources, but at least coal, charcoal, and the rest are known to be transition. So if you want to promote people from moving into a better fuel, you move them from the primitive energy sources to the transition fuel. But I'll put briquettes over the transition fuel, but it's still not a clean source of energy. Data from Kenya suggests that a bag of charcoal costs about 30 kilograms. A bag of charcoal is about 30 kilograms costs about $30. However, a bag of biomass briquettes, which is 50 kilograms, costs less, $15, which means briquette is a bit cheaper than charcoal. A bag of briquettes lasts longer when you are burning it. It lasts longer, or using it, cooking it. It lasts longer, about 3 times that charcoal. In terms of health, briquette is carbonized, and for that reason, it emits less carbon dioxide, particulate matter, and it also emits less smoke, which again is better than charcoal, the traditional food that the poor community have been using. So normally the reason why we are associating household pollution to diseases is the fact that household pollution, when you burn wood or charcoal, you are emitting about 2,000 chemicals. And each of these chemicals, has been likened to the chemical that is generated when you smoke cigarettes. So smoke from cigarettes is comparable to smoke generated from wood fire. And for that reason, that's the more reason why household pollution is linked to diseases. But if you use briquettes, you are emitting less chemicals. So it's in terms of health, it's better than charcoal. In the environment, briquette, invasive aquatic is waste, is a nuisance in the environment. So converting the waste into energy in a way you are trying to manage waste in the community. We'll look at the next slide. We'll look at the impact. The invasive aquatic has a lot of impact on the community. It prevents transportation, fishing. So if we're able to manage it through briquette production, then you improve the livelihood of the community, and you ease transportation and so forth and so forth. Whereas charcoal and wood rely on leads to deforestation, briquettes rather is environmental friendly because you are utilizing waste. And again, briquettes can also, I know charcoal can also increase, it's an opportunity to increase for the local people. Briquette can also do the same. But if you weigh the advantages, briquette has several advantages over the traditional fuel. If you look at the impacts, of briquettes, if you convert invasive aquatic with less pollutant briquettes, there are 3 of the SDGs that is satisfied. 1, you decrease diseases, you promote livelihood. So in that sense, you are reducing poverty. So it satisfies SDG 1. It also satisfies SDG 3, you are promoting health. And because in the community, we know that briquette has been preventing people from moving from one end to the other end. Most children who have to attend schools at the other end of the community are not able to attend school. So at least it's also helped address SDG 7. Then again, it helped address SDG, because we know that household pollution contributes a lot, especially black carbon, contributes a lot to climate change. By converting briquettes to wheat to briquettes, you are also helping to address SDG 13. So it's beyond the benefit to the community. It has a wide implication for the country in terms of its benefits. It's helping to meet most of the SDGs, some of the SDGs. The objective of this study was to reduce the burden of NCDs in riparian communities by promoting the use of invasive aquatic with biomass briquettes. The specific ones are to optimize the production of biomass briquettes using locally available aquatic weeds, then to assess fuel use, cooking practices, and impact of fuel choice on household pollution and NCDs. The third one will be to evaluate the effectiveness of biomass briquette implementation trial aimed at assessing the impact of the use of aquatic biomass briquettes on, one, in the case of indoor air quality, NCDs, and livelihood. Also, to further look at the exposure response association between household air pollution and NCDs. The project was also aimed at building the capacity of local people by giving them training on how to produce briquettes, so they can create the job, they can get some income from that. Those projects was done in the eastern region, actually the Lower Volta. The Lower Volta is bordered by the eastern region, the Greater Accra region. The Greater Accra region side is Pong, upper one, and the Greater Accra East region side is Estuary, the down one, the blue one, and the eastern region side is Pong. So the communities that were selected were communities around the Volta, Lower Volta, from Estuary and Pong. First objective was to, I must admit that we had funding for VRE for this project, but I'll talk about the funding issue and where we got to. Now, when you want to produce briquettes, those are the process. For a very long time, the manual management is what has been applied by VRE. M.Sc. VRE spends about over 300,000 every year trying to manage, but they've not been very successful. So I think this is a better way of managing aquatic weeds on the Volta Lake. So because aquatic weeds are just small, you can just harvest them. If you look at the other side, it's being dried. So harvest and dry them here. So these are dried weeds that are being collected. Unfortunately, when occasionally there was rainfall, so they were wet. We had a lot of challenges with that. So you dry them and you carbonize them. Means you burn them. Carbonization means you burn them. Then when you burn them, you add a binder. In this case, we use starch. So the binder holds the particles together and makes them compact a bit. With this one, we're trying to find a formula for the briquettes. So we need to do a lot of trials. So we bind them, we add a binder, then we cool and dry it. Then a dry briquettes together with, because we wanted to compare the dry briquettes, some parameters of dry briquettes and the charcoal and wood fuel. This wood fuel and charcoal are what are used in the community. So we want to try to compare the properties, which of them is superior. So we sent the samples to Ghana State Authority for proximate analysis. In the proximate analysis, they do the moisture content, the matter. They actually look at the dry matter. They look at ash content, calorific value, ignition test. They do the burning rates. That's what they do for the proximate analysis at Ghana State Authority. I must say that because this is the first study, actually most briquette has been tried. There are some companies I know about 4 or 5 companies that manufacture briquettes, but none of them knows the ratio, the dry mass to binder ratio. They just mix them up and export. For example, we know of one company that exports briquette to Finland and other parts of the world. But if you ask them at the ratio they use, they don't have that idea. So what we were doing is to try to get a formula. Then when we train the community, we train them with the formula. So they are going to work on the formula to produce briquette for the population. So what we did was that we varied the ratio of the dry mass against the starch. The first was 50-50. The next one was 60-40. The next one was 70-30. And the last one was 80-20. Actually, to get because there's no formula, we need to do series of this to get a right formula that will give us the best briquettes. But at the point you ran out of funds, VRA was not willing to put more money into this. So we ended up with these 4 samples. And so these are the parameters we got. The moisture content for briquettes should be around 4% to 7.67%. But if you look at all the samples, those are wood charcoal, firewood, and these four are our samples. Realize that it appears the wood charcoal, the firewood has a lot of moisture. The first two samples had very little moisture. What it means is that the binder concentration is very high. Once the binder is too much, it becomes very hard. Then you can't burn it. So if you compare the ignition test, the first one misfire, it didn't burn at all because it was too hard. The second one, the same thing. The third one, it was this one that's burnt because of the fact that we had very low moisture point, which is an indication that the binder concentration is very high. Volatile matter content was very high for the first one. And also, if you compare the reference samples, ours was close to that of charcoal. Then the ash content. The ash content signifies the inorganic substances in the material. If you produce a lot of ashes, it means you waste a lot of money because you need a lot of the material to cook. So if you look at all the samples, it's only the sample that the ash content is less. It's what it means that and also wood, compared to wood and the fourth sample. The fourth sample in wood, if you use it to cook, it will last longer. It means economically, thus and charcoal, especially the first three, are not economically viable if you have to give it to the community. Then we look at the fixed carbon content. Ours was close to that of wood. Then the calorific value, relatively, they were all close. The calorific value were all close. But what is very key is the ignition test. But the ignition test shows that the first three samples, our samples, cannot be used in the community. So if we had a lot of funds, then what we could have done is to keep on varying the dry mass ratio and the binder ratio to see if we can get a formula for the community. And once we get a formula, as I said, then we use that formula. We take that formula to the community and start producing briquettes for the community. So we didn't have enough funding to continue with this exercise. So we ended. I know we have intention to collaborate with others or go further to try to get a formula for those products, the briquettes. The next objective is to assess fuel use cooking practices, and that's a baseline data collection. So we plan to do a class randomized control trial where the house level was our definition of cluster. Let's go to the sampling techniques. We first did, because there was no census data, the Ghana State Council has no data, so we asked the field workers to do counting of households. So they did counting of household in these two communities. They counted all the household. Then in this community, we have 4 electoral areas in the eastern region and 1 electoral area. So the whole electorate is a 1 electoral area. We have 16 communities in the eastern region and 6 communities at the electorate. And we have 1,730. If we say a house is, in our definition of a house is a number of households that share the same space. So in Ghana, we call it a compound house. The number of households that share the same space. Then we have about 1,730 houses sharing the same space with a number of households. Then we have in the eastern, we have 177. Within the houses, we have the household. So of the 1,730, we have 8 more than 8,000 households in the eastern region, and also in the Greater Accra, in the eastern region, we have about 476 households. Then initially, because we learned lessons from a previous study that was carried out at Kintampo. What they did was they gave household LPG, cook stove, and fuel. Then one house, there were three arms. One household, they gave LPG, cook stove, and the fuel. And the household, they gave the Phillips. The Phillips rely on use traditional fuel. And then the third household, they asked them to use the traditional fuel. At the end of the study, what they realized was that, of course, they were looking at birth outcomes. There were some improvements in birth outcomes in the intervention household. But when they measure PM 2.5, they were disappointed because they couldn't achieve the reduction expected. And the reason was that there was cross-contamination from households. So if you give LPG to this household and you allow this household to use the traditional fuel, then there will be cross-contamination. There was emission from smoke from this household that goes into intervention household. So we learned a lesson from there. So what we did was that in each household, we're going to give, everybody will enjoy the briquettes. Because there was no money, we assumed, what we did was that houses that contain more than at least 4 households, we're going to give them the briquettes. So if you have a compound house or a house, you have more than 4 households, then we exclude you from the study. But you have a maximum of 4 households, then we consider. So every person in that house or compound house will be given a briquette. That was the whole plan. And then the sample size, we use this formula for sample size calculation. In a previous meta-analysis that was published in Environment International, the reduction in PM 2.5 for improved cook stove was about 30%. And that's in the in LPG household was a bit more. I think it was around 60 or something % reduction. So we assume that briquettes will lie between improved cook stove and then LPG. So we took the average, that is 25. We took the average and we used that as, for example, if we administer the intervention, we expect to see about 25% reduction in PM 2.5 level. So we base that assumption on previous publications. Using the class correlation of that and intra-class correlation of 0.1 and type 1 error power, we got a sample size of about 232. And then by accommodating for non-response, we had 274. But we initially thought of using 1-to-1 ratio intervention and control arm ratio. So what it means that we divide it by 2, the same thing goes to the intervention arm and then the control arm. So we had, and we use, because there are more communities in Pong than Asuchari. So using the proportional to size calculation, we had 39 from Asuchari, and then 235. Now mind you, we have control intervention arms in at Asuchari, we have control intervention arms at Pong. So that comes back to the 1:1 ratio, but that is the number of households we selected from those communities. Now there's the idea at the randomization. That's we had a nice plan at the time. So we did the baseline together with the sort for formula for the briquettes. So once we get a formula, our intentions is to use 4 to 6 months to do the baseline and also to train the local people on production of briquettes. Then about 2 to 3 months once we have the briquettes, 2 to 3 months for the implementation of the intervention, then 2 to 4 months for midlife follow-up, then 2 to 4 months for end-life follow-up. But unfortunately, as I told you, because of funding, we couldn't proceed. We ended up at baseline, and also and so this was the intervention. The idea was to provide weekly supply, constant supply of briquette to households. That's the whole idea. So that's because of funding, we couldn't. But at least I'll provide some preliminary result for the baseline, also what the data we collected at baseline. So at baseline, we adapted the WHO modified household air pollution questionnaire. Of course, we added a lot of things to it, and then we load it up on REDCap. And these are some of the areas. We have questions for adults and parents, children and parents, sorry. And the questions cover these areas. We also looked at, because our interests were on NCD, so we measured blood pressure in participants. This is one of my Ph.D. students who is also a nurse at one of the big hospitals in Accra. Then these are some of the things we did for the lung function parameters. Then we took some anthropometric data of both parents. And we had there are several types of monitors. We have monitors that rely on filters. They call them gravimetric monitors, and these are sensors-based. The sensors, although they are good, they give more of an indirect measure of exposure. But the gravimetric are good because it tells you how much the person is exposed to. So these are personal monitors. So the participants will wear an apron. What you want to capture is exposures or carbon monoxide levels and PM particle levels around the breathing zone. So we make sure we had an apron, they wore the apron. Then those were the particular entrance for the particles to enter into the system. There's another entrance for the pass plus. So there's a pass plus for carbon monoxide, and there's a last carbon for carbon monoxide, and there's the pass plus for the particle specifically. So we did this for 24 hours. I thought it was for 48, but I think it's 24 hours. We monitor about 375 households in the area, but with the questionnaire we administered to almost every household, 420 households. We also had, this was from a work I did for WHO, and once you do some work, then the instrument is, so that's for indoor measurements. They are sensors, and because they are sensors, we need to co-locate. So we co-locate this with the millivolts at EPA's office. So once you co-locate, because these are not very accurate, they are sensors, they are subject to several factors. And so when you do the co-location, you check whether you put the standard monitor and the sensor in the same environment, then you check what they are measuring. So you can develop a formula, a correction formula. So any reading that you get for this one, you multiply by the correction formula. So that's what we did. We did the co-location. We had a correction formula, the correction factor. Then before we install this in-house, it will rely on the challenge is that we need to sometimes provide some money for the people because we are using the electricity. So we did this for the same number of households that we did the personal monitoring. So these are preliminary results for the baseline. The gender characteristics of the baseline of the population. We have formation for primary cooks, and then I think the household head. So this is for the primary cook. A primary cook is somebody who cooks most of the time for the household, and the head of the household. Family information we took from the head of the household. And then we also look at the type of stoves they use. There's a 3-stone fire. 3-stone fire traditionally it's built with clay or sometimes with stone. 1, 2, 3, you put the wood in between. So about 14.6%, about 61 people have the three stone fire as a primary stove. Charcoal stove, the majority of the household rely on charcoal stoves. I mean, in the community, most of them utilize charcoal. LPG, not 88 is quite, it's even more. They use LPG stove more than the traditional open fire. And solid fuel, there are some that just answer solid fuel. So I think you could have ignored them, but we don't know what they mean by solid fuel. So there was only one person. Secondary fuel, so you have primary fuel users, secondary fuel users. So what it means is that the primary fuel, the primary stove is the stove you use most of the time for cooking. The primary and secondary stove and the tertiary stove are the stove that you don't use. You use for certain cooking. Then we also look at demographic characteristics by the primary stove usage. We didn't do that for the secondary and the tertiary. Realize that in multiple occupants, where you have several people occupying the same space in the household, they prefer using LPG than the charcoal stove and the three stone, the open fire, sorry. And when the person is renting, they use more of LPG than the three stone, the open fire, and the charcoal stove. So these are the bivariate information we have there. So also look at fuel usage, because if you have a primary stove, you have secondary stove, you have tertiary stove, definitely you also will have a primary fuel, secondary fuel, and tertiary fuel. So we looked at primary fuel. Most of the household use charcoal, the raw charcoal, followed by LPG as a primary fuel. I think charcoal runs through. Then if you do the bivariates, the soil doesn't change. It's not too different from what you saw previously. Then we also look at fuel stacking. Now, fuel stacking is the parallel use of fuel. So if you go to most households, I think even in developed countries it's there. Of course, we don't use it for cooking, but you use it for warming our household. In most places in developing countries, people use more than one fuel. And so, for example, in the first, we have 86 people of the 414 people who claim they provide information. 86 use LPG. Of the 86, 27 continue to use LPG. That's they use LPG exclusively, nothing else. But 11 people use charcoal. Besides using LPG, use charcoal as a secondary fuel. And then 48 use wood as a secondary fuel. Of the 267 that use charcoal, only 5 use LPG as a secondary fuel. The majority use wood. So there's a clear evidence of fuel stacking. No household use one particular. Of course, you have people relying exclusively on either any of the fuel, but there are a lot of people. Some people who do a lot of stuff use more than one fuel in the household. Then we want to look at the household air pollution exposures. Let me go back to the exposure. What we did with the exposure was that we use activity diary. Activity diaries are diaries that matches activities against time. So it allows the woman or the primary cook to be specific, to indicate where she or he was when an activity took place. We have a lot of activities taking place. And so we have exposure that occur exclusively in the kitchen. That's what we refer to as CA. So from the activity that we're able to distinguish between exposure that occur exclusively that are related to cooking activities and those that are not related to cooking activities. It means the person was outside the kitchen when the exposure occurred. And then the two combined is a total. And so generally we see the exposure that relates to kitchen activities seems to be very high for PM and also for carbon monoxide. But we couldn't do that for the outdoor because the indoor, we had a substance. Then we did a correlation and we did the correlation analysis. There was some correlation because we wanted to control for each of the exposure variables in each other in the model. So we have to do the correlation. Those that are highly correlated, we can't put them in the same model. That's the whole idea. So that's the background information in relation to exposure information for PM and also for outdoor and also. So our health outcomes, we were interested in cooking-related burns. Cooking-related burns when burns occur to you when you are in the kitchen. So for example, in the last 12 months, we had about 132 people claiming they experienced some burns. And then the severity of burns is measured by the scar that is generated by the burns. So we had about 81. Most of them had small scar. And this information is very important because this is highly reported. And so the WHO is advocating for a data repository for cooking-related burns. So that's why it's important to get information how many people suffer burns related to. And so, and the location of burns, most of them had it in the kitchen. Then the mechanism, most of them had it when they touched the hot stove. And then we also look at burns occurring in children as well. I think the story is, it doesn't change matter. With the children, most of them had large scars. In the severity, they had more severe burns. It occurred in the kitchen, but most women take the children to the kitchen. And we come to lung function parameters. And we did the pre-bronchodilator, where pre-bronchodilator and post-bronchodilator. Pre-bronchodilator is when we give something like a medication. So if the person has a COPD, we hope it will be cleared. And want to see whether the person, whether whatever we are recording is not due to some inflammation. So people with inflammation, I think we'll see high values will never change much. So if it's not due to inflammation, then the low values may change. So we did a bronchodilator, pre and post bronchodilator for all, for FVC, FVU1, and the ratio. We have other parameters that I didn't show here. We did several information on several parameters. Those are the team that we have 2 nurses that we work with. And yeah, we have 3 nurses, 4 nurses, sorry, and these are a PhD student, and MPhD, a graduate, and a PhD graduate. So these are the team that we work. So in conclusion, we have the information on the formula was not, we needed more money, because at least to get a formula for the people. But at least what we got wasn't bad, because we saw that the moisture content in the 4th sample was within standard, and we saw that it's actual bent. But we needed to go further, another stage, to see whether we can also replicate that in different ratios, and that is what we couldn't do because of funds. And in conclusion, there's clear evidence that fuel use, people use different fuel, there's different fuel patterns used in the community, and also household pollution is real. Stacking is very common. So the WHO is advocating for the use of clean fuel, but most household do stack. So if we're using clean fuel and stacking, how do you achieve the WHO guideline? It's very difficult. So I think the question is, how do you motivate people from using dirty stacking? How do you move them to clean stacking? Clean stacking is using more of a cleaner fuel than a dirty fuel. So those are the things that we hope to investigate in the next step. Thank you very much.
Okay, thank you.
Our standard, they are who provided some small funding for those work.
Well, thank you so much. Questions?
Yeah, I do have a question, a couple of them. Thanks for the presentation. I think that's interesting, and I believe you probably would have more robust sort of feedback if you were able to pursue this study further. But one with regards to the outcomes, I'm just wondering if you're trying to assess exposure to, let's say, carbon monoxide, why didn't you rather assess carbon monoxide poisoning within the individuals? There may be some instruments to be able to assess that. I know the use of the spirometer, the FEC, and the ratio gives a sense of some level of acute bronchitis or some issues that have to do with lung disease. But I'm thinking more of if you're looking at carbon monoxide poisoning, that could easily be assessed. Then you can relate that to their exposure to PM2.5 or PM10, right? And number two, I'm just wondering if you were able to, even though at baseline, were you able to see the effectiveness of briquettes compared to, let's say, wood or charcoal? What was the effect size? Did you see a bigger effect size for briquettes compared to the charcoal or wood, or did you see a smaller effect size? That can also tell us whether briquettes has some value, unless you didn't use briquettes in this particular study. But if I could have a sense of that. And number three, let's say if you have funding, what would be the next step?
Okay. Thank you very much. I think the first question, carbon monoxide poison occurs only at a very high concentration. You would never get in the kitchen. In the kitchen, you have chronic exposure. Probably a high concentration may occur in a garage where somebody's locked up in a garage. Then the fumes from the garage, you intentionally park your car and leave it on for some days. The person is carrying. So I think probably in the kitchen environment, I think small, low-level exposures are what it's important. I think that the next good question also would, of course, we didn't do the intervention, but of course in the lab we can. Our parameters suggest that in any case, the briquettes might be a better option than the other traditional fuel, although we didn't continue with analysis. But what we wanted to demonstrate is whether, which of these two, the briquette and the traditional, which of them can result in reduction in NCDs. That's what we didn't do. But at least in the lab work, the small thing we did suggests that the briquette is probably superior on certain parameters than the traditional fuel. But as to whether their effectiveness in reducing NCDs, I think we need to carry out the field work to be able to establish that. Yes, that's what we are hoping for. I think it's very important, that study is very important because the people are deprived of livelihood. I didn't give a little, for example, once you have the briquettes, it suffocates the fish ecosystem. So most fishes there will die. So if you're a fisherman, there's nothing to fish. It also prevents transportation. So if men are not going for fishing because there's no fish, women are not engaged in any trade, then they only resort to farming. Then we know what farming does. Then we use a lot of chemicals in farming, then we end up polluting the water the more. So the chemical that comes into the water serves as a nutrient for the aquatic weeds. Then they blossom. there's no way you can manage it. So I think by controlling the weeds in the environment, by converting them into weeds, into briquettes, would be a better option of managing to ensure. One thing that we're working the fisheries with the fishery department, wanted to see if by harvesting the weeds, whether it can change the water ecosystem. We mean the fish health, abundance, and diversity. Of course, the small, we never got funded. How much more this complicated? So these are areas we can always move into to see the benefit the committee will accrue from such a study.
I have a question. So how complex is producing these briquettes? Can they be made locally, or?
Yes, they can be made locally. If we go back to the diagram. Sorry. I think we need local. Go back to. Yes, 22. Yes, we use drums. So local materials. You can use local materials to do. But of course, the better option. If you do this manually, you are not able to get rid of the moisture. The best thing, I think, before we started this project, I had conversation with some guys in Kenya. It doesn't cost a lot. You can use a small equipment which can help squeeze out the moisture. But when the moisture is in there, it generates a lot of smoke. Assuming you have charcoal and it's moisty, then you generate a lot of smoke. And so I think manual production is not the best, but at least the best option is to do this using a machine, and that can reduce a lot of the moisture. Okay.
Sounds like it's something that, on a community-wide basis, would be worthwhile investing in.
Yeah, investing in it. Yes. And we thought of even training the assemblies can own this one, and they run it. And that we have a lot of issue with ours. But I think if we have a very good leader who can manage this, I think it's a very viable thing. If we know that there's a way of managing the waste on the water, I think it would be a very good thing.
Yeah, sort of a win-win on many levels. Yeah. Yes.
Oh,
I don't know who had their hand up first.
Oh, okay. Were there any issues with briquette uptake in the households?
Because we didn't do the intervention, we never measured uptake.
Oh.
We wanted to look at, we should have looked at acceptability and uptake, but we didn't measure it because we never implemented in the first place.
Thank you, Professor Quansah, for a great presentation. It's a really interesting concept. A lot of potential benefits both for health and ecology and economy. So great, comprehensive project. I have a question actually about one of the slides, the cost-benefit analysis slide.
Okay.
Can you move that one?
I think those.
Yes. Yes, there.
Okay.
On the health perspective, so that second bullet point, this means disease associated with these chemicals are less common in briquette communities compared to charcoal communities. Is that demonstrated, or is that an assumption based on the exhaust generated by burning? Those two different kinds of
I think with charcoal, we know that charcoal and wood are able to generate over 2,000 chemicals. And as I said from the beginning, the chemicals that are generated are equivalent to chemicals that is generated when you smoke cigarettes. But we don't know of briquettes. But what we know is that if briquette is superior to charcoal, then you'll be able to emit less chemicals than charcoal. So that's the basis.
So it's
saying that.
That assertion is on the basis of lab studies of burning outputs.
Yes.
It's not an epidemiological finding.
But definitely you can't do with charcoal. You can't do that. You cannot do that in the lab. Yes. So at least Well, this work was done by NEA and in the States, where they did a control laboratory experiments, and they measured the chemicals that were emitted, and they were able to record about 2,000 chemicals. And when they compare the chemical that's been emitted here, it was comparable to that emitted by.
So I follow the lab portion of it. The question is about the epidemiology. We have probably good data on the health effects of charcoal burning.
Yes.
Do we have good data on briquette burning?
We don't have any.
Right. So the question I had to follow up on, are there models of local briquette manufacturing and supply to homes for cooking fuel in other parts of West Africa or?
We have in Ghana. I know of, there are quite a number of them, but I know of only one company. Actually, they were the one who led the production of briquettes. They have been exporting briquette to. So I know when we went to their factory, they had some consignment they were sending to Finland. And so they have been exporting. I was there. When they go through the protocol, you have to send it to lab for testing and so forth and so forth. And you have to meet the specification of the recipient country.
And what are those briquettes used for in Finland?
And I think in this part of the world it's used for warming. I'm not too sure if it's any other thing. But they are sent to Finland, in Europe, and I'm not too sure about North America. I know that they send their products to Europe and Asia.
So if there's a local market for this, if people are spending a lot of money and they see a charcoal or wood, why hasn't that happened yet? Why are things being exported at great cost, of course, with such large volumes? There's a clear market here.
I think the issue is about acceptability. You can produce briquette from several different ones. The product is organic in nature. Briquette can be produced from corn husk, coconut husk, and the rest. But the reason why we went in for briquette is that those materials contain a lot of lignin, whereas the cellulose and semicellulose is very rich in briquettes. And so that is, the cellulose and the semicellulose define the energy content, which means wheat has more energy content than the rest. I think in Ghana, it's about publicity. We are not aware. If you go to most of the malls, they sell briquettes, and people do buy them, but how many of them? And the knowledge that is in the long term is cheaper than charcoal is not there. We need a lot of education for people to understand that. I think we are not promoting that enough.
So is there any dialogue in the Ministry of Health or anybody or energy to encourage the use of briquettes for homes?
At the ministry, the emphasis has been on it's politics. It has been on LPG. Because yes, because the WHO and other agencies are pushing for. So Ghana, we have the LPG recirculation model. Kenya has another model. So it's an issue of politics. But I think if you look at the entire nation, not everybody is cut out for LPG. So we need to define a fuel, a very good fuel for the lower income country communities, and that is what we are not doing.
That's the reason you need to
Yeah. And even LPG, we are competing with vehicles, because vehicles these days also use LPG. So so it becomes a problem in Kenya.
Thank you very much.
Okay, well, I guess we're close to our time.
Okay.
So thank you so much, Reginald, for sharing your interesting research and your findings. And well, we look forward to your future results. Hopefully you get funded to do the next stage. And yeah, very important research. Thank you.
Thank you very much.